Hi, my name is Ngozi Obi. So I'm going to talk to you about my topic, which is on the Northern California wildfires of 2017. And the wildfires are becoming more and more common now, especially with the climate change, which is occurring as a result of the warming of our planet. So, California has become very notorious as a result of it, and it's becoming more worrisome every year as we are witnessing now. So, in 2017, there was a major fire that happened in October. Usually, the wildfire season starts in early October, usually by October 1st of every year. But in 2017, on the 8th of October, about a dozen wildfires started raging across Northern California in multiple counties. And within a span of one day, these fires covered many counties. And this was as a result of very dry conditions because the area gets very little, the area was very dry as a result of low humidity and also very high winds that were gusting off up to 70 miles per hour. So these high winds really spread the fire very fast, and as a result of dry leaves and trees, they covered over 228,000 acres, burning over 90,000 homes and burning over 10,000 structures and resulting in evacuation of almost 100,000 people. And as a result of this, many homes and structures getting affected. Healthcare facilities were also affected. Nursing homes were also affected, and this resulted in a lot of evacuations. A lot of people lost their lives. Up to 44 people died, including some firefighters that were trying to control the fires. Majority of the deaths occurred as a result of the Tubbs fire, which at that time was the third largest fire in California history, and it affected most parts of Napa and Sonoma. And overall, about 192 individuals were hospitalized due to exposures or injuries sustained in the fires. The key players and participants in the event were mostly the government of California, the Governor Edmund G. Brown, the state health department, the federal government, the FEMA, the Federal Emergency Management Agency, the California National Guard, the California Department of Forestry, Fire Protection, CAL FIRE, the local health departments, because this affected many counties. So the local health departments in these counties, the local emergency departments and hospitals and medical centers in the area, local law enforcement, the cities and social services in the areas, and of course, many volunteers, the volunteers in various areas of response. And these key players and participants performed various functions, down from the emergency operations center and down to supporting the evacuees at the shelters. So in terms of incident command system roles of the for public health professionals, the main 5 functions of the incident command system is command, operation, planning, logistics, and finance and administration. So the command mainly is in terms of the chain of command, where the information gets passed down from. So this mainly is from the Emergency Operations Center that was set up immediately, because that's where things are coordinated from. And then the Joint Information Center that was very important to determine how information is passed and disseminated and passed to the public as well, to how information gets passed on to the residents and communication as well. Then operations, how things actually get done, the day-to-day, and then the planning of things, because of course a lot of planning has to go into what gets done, and then logistics, how things are coordinated, and then the finance and administration, which is important because you need money, you need resources, you need things to be provided to actually get the response to the emergency to be accomplished. And then the assessment of the participants' response. So how did these participants accomplish what they did So first of all was that when the fire started on October 8th, the governor, having seen the magnitude of these fires and the vast areas that were affected, so he declared an emergency proclamation for those counties that were affected. And these were the were Butte Lake, Sonoma, Napa, Mendocino, Yuba, Nevada, Orange, Lake counties on the 9th of October. And by the following day, I mean, the coverage was very wide, and the president, was already aware of it. So having seen the severity of the fires, the president, Trump, declared a presidential disaster declaration on October 10th. And immediately this was done, this helped to escalate the response because it brought in the federal attention and brought in federal resources, brought in FEMA, and this was coordinated with the local and state resources to help to mobilize things to help support the response operation in the state. Another thing that was done was with this, the state at the local level, because the cities and the counties at the local level, because they have over the years been working together, they were able to leverage the strong relationships that they have to coordinate their response and evacuation plan. And this was really demonstrated in the evacuation of 2 hospitals in Sonoma that needed to be evacuated because they were being affected by smoke and coming from the fires. These hospitals had over 1,100 patients, some very sick patients in critical care that needed to be evacuated. Local officials came and assisted the hospital staff to move these patients, and they were able to get everybody out from the hospital, evacuated everybody safely without any incident. Another scenario where they were able to move individuals was in a residential facility for developmentally disabled individuals. They had over 200 people in this facility, and local officials also assisted the staff of this hospital, of this facility, to evacuate these individuals safely without any incident. One other thing that he did that was very efficient in the response was the use of a mapping software. So this mapping software enabled them to track the evacuation and also enabled them to guide them so that they avoided roads that were blocked and avoided areas that were affected by fire. It also enabled them to locate shelters that were in nearby areas without wasting too much time on the road. The California Department of Public Health sent out their they sent their staff and resources to shelters to support individuals that were evacuated to these shelters. They also sent their public health nurses to provide mental health services, provide medical services to support the individuals in the shelters. They also provided cots and blankets and other supplies that these individuals will need in these shelters. Although all these response operations were they did a very good job, doing all these response activities, there were some things that did not work well. One thing that did not work very effectively was the warning signals. The warning did not go very well. Some areas, especially in the valley area, did not receive the warnings. Some people received warnings very late, especially areas that the local officials were using phone dialing system to call people. So it took so long, or the calls came in late, or the calls did not come at all because of interruption by the cell towers being destroyed by fire. So individuals were injured, or some people actually died. In Mendocino County, 9 people died trying to escape from the fire or escape from their homes. Then evaluation of the community preparedness or demonstration of resilience of these communities. As a result of years of planning and investment in public infrastructure by the state and local communities, and also preparation by these individuals in these communities, they were well prepared. They knew what to do. They had all the information on what to do and how to respond. So they were able to respond sooner and also get people out and get people the resources they need and get people help that they needed. And this helped the communities to get better and also start recovering as quickly as possible. Also, the healthcare facilities and officials were well trained. They've had years of training and drills and exercises and practice. So they were able to evacuate individuals. They were able to deliver medical services. They were able to respond to help people in the hospitals and even in the communities. as soon as people needed help. And then also they had availability of online resources such as psychological first aid training for health professionals, so that they will be able to help people in their communities. And also even for the public, they had access to online mental health services for them, so that they could also have online counseling for the public as well. And in the shelf, through some websites like natural websites, where they could access some of these resources. And then in the shelters, they had access to mental and behavioral health services as well. Then volunteers and neighbors were really helpful in supporting people in their communities as well. And then FEMA was really supportive to these communities because they provided emergency disaster declaration in terms of public assistance, financial assistance for these counties, for these individuals, so that people could apply for assistance that they could use to repair their damaged infrastructure for the counties. And also individuals could apply for financial assistance to repair their damaged homes when they come back after the fire has been controlled. Then, so discussion of some of the changes to the emergency management. So some of the changes that occurred, or some of the things that were effective, was the mapping software was really effective because it helped to track the evacuation and it made it very effective. So they saved time, they saved a lot of lives. It helped them to be more effective. And then this software, since that time, has been included in majority of the state facilities, in the hospitals and in the schools. And in fact, in subsequent emergencies, they use it to track what they're doing, and it's proposed to be good to help to save lives and save time as well. And following this incident in 2017, the 2011 Public Health Emergency Preparedness document has been updated. It was updated in 2018, and additional information has been added according to the national guidelines, and to update it according to national standards. And then the California Office of Governor's Office of Emergency Services also had information on its website that was available in both English and Spanish for the public, so that they could also access information about disaster, what to do. They had information in videos and in written forms for people as well, and also how to get assistance also there. They also had information on their social media websites as well. And then information on health advisories, air quality was also available, and also in recovery and cleanup for them. And all these were supposed to help people to be more, help people to know what to do in terms of the emergency. And that's pretty much all I have. And thank you so much for listening, and bye-bye. And these are references.